Available.
Hi everybody. This is not going to be a happy video, and I'm going to say trigger warning for talk of suicide and self-injury and uh, depressing thoughts about mental illness. So I don't know how Tommy does it. I think she edits or something to give you a chance to um, stop the video. So, but I guess what I'll do is just because I can't edit videos, I'll pause for I don't know, a while, and then you guys can shut it off if you want. Okay, ready? 1, 2, 3. Okay, that should give enough time for you to shut off the video. So, mental illness is a silent killer. When people get diagnosed with... Oh, shush. I'm going to have to figure out this update thing so it stops yelling at me. When people get diagnosed with a mental illness... No, when people get diagnosed with, cancer or AIDS or whatever, they freak out because, and it's traumatic because they know that they could die. And even with medications, and everyone's like, okay, we're going to just take this one day at a time, and there's that thing in the back of their mind that they could die from this, and that everyone loved ones is upset. Just hearing about anyone diagnosed with any kind of cancer is scary because you could die, and that from the beginning, and you just have to fight to be strong and go forward one minute at a time, whatever, with whatever treatments they have and medications. And but I imagine, I don't know this because I don't have that kind of illness. Trigger for suicidal thoughts. I've always said to myself that if I ever got that sick, I would just kill myself because I wouldn't be able to deal with the physical issues and the emotional issues, and I would just die. But Jess says that I'm stronger than that, and she went through this huge medical thing, and she survived it physically, even though she almost died, and emotionally. So anyway, people have that understanding. They don't have that understanding when you have a diagnosis of a mental illness, people don't even know to go to a psychiatrist or the doctor, or to take their kids when they start showing symptoms of depression and anxiety and different things, to even go get it checked out, to start getting medication or to start getting therapy. They just say, oh, it's just a phase, or oh, that person's just too sensitive. I mean, I got that through my whole teenage years. I could have been given medications like Ativan, for anxiety. I could have been given, when I was 18, I started therapy with not the best therapist, but at least, I eventually found a really good therapist that I worked with for 2 years, and another one that I worked with. And, that was helping, but before 18, they made me see this one counselor for a specific problem, and she wasn't very good, and I didn't know I could change therapists. And anyway, so you don't know to go to anything to get help for it, and then I think it just gets worse and worse over time. And there are some people that they're depressed over the thing that triggers it could be friends moving away, or a death in the family or something could trigger it. And for some people, they could come out of it within a few months or a year or something. And then for another person, that could be the start of a lifetime issue. And I think what's hard is the same diagnosis is completely different for every single person. Every single person that has depression has it differently, and has different symptoms. There are a list of symptoms that are possibly could be there, but everything is different for each individual. And I think that's what's unique about mental illness to like other illnesses is I'm sure that like I don't know this personally, but I'm sure like people that have like cancer or like diabetes, like their symptoms are like pretty similar across the board from like other people's. Maybe not like as severe certain ones, but I'm sure it's like, you're not like, oh, there's this and then like this other person has like this other weird thing that like, doesn't conform to anything. And I think that's like so unique is that each person has their own set of what's symptoms, and then so each person has to have like different treatment. Like meds work totally differently on different people. I mean, like with meds in general, there are like side effects, but like it's not even like, oh, this one certain med like works really well, but it has this side effects. Like with maybe like cancer or like AIDS, they sort of know like, okay, this med is going to basically work on everybody. Like they don't know that for like these different meds, like, and everybody has totally different reactions to them. Everyone has totally different reactions to therapy. It's not like if you break your arm or whatever and you go to physical therapy and you know how long it's going to be, and then you're going to get better. Like they don't have that confidence. The doctors don't have that confidence in mental illness, to say like, okay, we know what this is and like this is how long it's going to take, or like this is what you need to do during your life to like maintain it. We know what the certain things are, and I wish that there was a way to really do something. I mean, there are a lot of things going on in like neuroscience that are like advancing about the brain and like different therapies that like affect the brain, which would totally change like, if you're changing like the neural pathways or whatever, you're going to change people's like emotions and stuff, on a brain level. But I wish that Miss Baby wants to say hi. I wish that there was, a set sort of thing of like, this is what we know about this, this is what we're going to do, and this is what basically is going to work across the board, like there would be with other treatments. And I mean, sure, with like physical illness, I'm sure there's like a lot they don't know, and like there are always new things coming out, but I just feel like, when you have the flu, to like rest and like take Tylenol and, you'll be okay after a couple weeks. Even if you're diagnosed with like mild depression, you don't know how long it's going to last or whatever, and you don't know if you'll be like predisposed to having it again, and you don't know if it's going to be like a pattern for you throughout your life. But what I was going back to earlier about, physical illness, where people know when they're diagnosed with like, depression that's gone on for a while, or like when things seem to be getting worse, and even if someone has like is psychotic or a schizophrenia, like people are like, oh, well, they know that that's like a serious mental illness, but they don't know like everything about it like you would on a physical illness where you could like learn so much. I think it's hard because people don't know how risky like and how serious like mental illness is. Like I think some people are like think, oh, well, like mental illness is like so horrible, like we can't even talk about it because these people are like inherently crazy and it's just their fault and whatever, and they don't understand that it's like within your brain, like the chemistry. But I wish that there was like more like a precise way of saying like, okay, this is exactly what's going on. Like with your blood or whatever, they have all these like medical terms for like, okay, this blood cell thing is too high and this one's too low, and I don't know anything about medicine, but they can test all this. I mean, what they do when you go to the hospital, even for psych stuff, the first thing they do is test your blood and test your urine and everything else like that. So with like your body, they can test all this stuff and they know like precisely what's going on basically. I mean, they make mistakes, but with mental illness, they know that it's like a chemical thing in your brain, but they don't know like precisely exactly what's going on, and that's why for each person it's like different. So, but and people can get that level of education, and then there are people that are just like, oh, oh, it's not that big deal, like it's not even, it's just a normal thing, like no big deal or whatever, and so they don't really understand like how risky it can be, and that it's just so like chronic, and that it can be so chronic and it can change over time. Mental illness, someone could get like worse with like certain symptoms over time, or like certain symptoms could like go away and then come back, and then different things could happen, and I think that like living here with other people with all kinds of issues, it's really given me a lot of insight into other mental illnesses. Like, I didn't know anything like really about schizophrenia except what was like taught in college, and it's like totally different than meeting like all these different people that have it. Like, that's a big illness around here, and like so many people have it, like so many different like forms of it, like, and like everyone's experience with like hearing voices or whatever is different, and you know um just different treatments. Like, some things work and some things don't, and it's really sad because you have to say sometimes with mental illness, which I suppose you would say with physical illness too, like, okay, there's a person's baseline of like, this is what we expect of like their normal way of being with this illness, and sometimes it can be like, you would think like, oh my goodness, like why aren't they like getting better, or like in a better pace? How can that be like their normal way of functioning to where the illness is? Like, I guess an example is when I go up and see my PRC Edith, on her floor and near her office, like down the hall, on the same hallway I think it is, there's a woman that's in a single room for a reason. It's because her voices, or the thoughts she's having, the delusions or whatever, cause her to just scream and scream and scream and scream, and just yelling. And it's just horrible when you first hear it. And even when I'm up there and I'll hear it, and I'm like, what is that? And she'll be like, oh, that's this person, don't you remember? I'm like, yeah. But just the fact that I've talked to her several times, and I've been like, they can't make it any better so she's not sitting there screaming all day. I mean, I can't imagine what's going on in her head that makes her scream like that. It must be like incredibly emotionally painful of what's going on, and I don't know what's going on. We can't tell what's going on in someone else's head, but it's just like, and I was like, don't they give her medicine? And she's like, yeah, well, sometimes medicines can only do so much, and, this is like where we have her now. And, and I know people that are like baseline, like suicidal, or like every day they have some, thoughts of killing themselves or feelings about that, but they're, within a certain range of, okay, they're not gonna actually do it and they don't need to be hospitalized, but this is like what you can expect. And for me, I think it's like up and down. I mean, it depends on the day and what's going on. I've gotten a lot better with my symptoms lately, but that doesn't mean that, one day randomly something could happen. I mean, and that's what's weird about mental illness too, is people don't understand, like, you don't wake up one day and decide to go get in a fight with someone for no reason and like slam them against the wall and like beat them up. Like, nobody decides to like do that. And it might, a lot of things can be like learned, and like there's a lot you can do with therapy. But I think what's hard is like when it comes to the actual moment of being in crisis, sometimes all that stuff doesn't even work. And it's just really sad, and it makes me mad. Like, when I was in, when I went to the crisis center in March, and I had self-injured, I was really beating up on myself because I was like, I've learned all these tools and like all this stuff and had all these talks with people, but, when it comes to crisis, I didn't do it, so like, what's the point? But, Jonathan was like, well, you've done so much and like you've gotten so much better from like the point you were before. And he always talks about, like, he's really into sports, so he always talks about, like, say you're training for a marathon, and you're like, oh, well, I suck because I can't run 10 miles, but it's like, well, now you can, well, you used to not be able to run 6, and, like, now you can run 6, like, easily. So, I understand that, but it's still difficult. And I think the best part for me and for other people living here, I think, is living in an environment where, there isn't much that is going to, like, freak anybody out, because they've seen, like, everything that you could probably possibly see of somebody's symptoms, like, manifesting and things that you can do. Like, I was talking to Jonathan, like, Friday, and I was like, with the self-injury, it's hard because I don't think it's something that they've seen. Like, maybe they've seen it, like, someone that's done it before and, like, has stopped. But I don't think they've seen a lot of people, like, actively doing it. And even when it was just like scratching, he's sort of like, well, if people have different issues, like if people are like smoking, not in the smoking room, they know what to do. If people are like, fighting, they know what to do. If people are like trying to escape, not, run off and they're supposed to be on restriction, they know how to handle that. Someone could self-injure anywhere, and short of like tying somebody up or like drugging them, you can't stop someone from, self-injuring if they want to. And so it's really hard, but I think, they faced the challenge well, and now when they see someone doing it, I think, well, with me and other people here that do it, which is not too many other people, they know what's going on with that person. And like anything else, self-injury is different for different people, different reasons of why they do it, different ways they do it, and different treatments that are going to work. Same with eating disorders, which I don't think they have very much experience. So I actually look forward to the time when someone comes in here with an eating disorder that's, I'm sure they can't take like a severe person, but like, someone that's dealing with it on a day-to-day basis so they can learn more about it. So I think that they try their best to help you. And so they know. So if you just like yell at somebody or like totally like have a meltdown and be screaming, or if you push someone or if you hit someone, and that's like how your symptoms is like manifesting or whatever, they're never going to excuse it, but they're also not going to be like, oh my god, like terrible person, like why would you ever do that. They're going to understand that like you were under the influence of something that's like in a way not in your control. It's in control in a lot of ways. Like there's a lot you can do, and like there's a lot that you need to like take responsibility for your behavior, but there are parts of it that are like not in your control. And Jonathan, and he's the first therapist that has done this, like separating the illness from the person and saying like, this is your mental illness, and like we're on your side, and like the mental illness is on the other side, and like we are fighting your mental illness. And nobody's ever like had that like approach with me or like anyone of, this is what we're doing, we're not blaming you, we're working together with you, and we understand that like there are things that just happen, even if you plan for them, sometimes things just get too much and too overwhelming, and you just can't, you just can't fight it anymore. And I think that goes back to the thing I was thinking about tonight, which is the hard part of what I'm going to say is, people don't understand mental illness, I think, or like the connection between like suicide and mental illness, where like people could be like, oh, this person like killed themselves, but they don't really know why. They could just be like, oh, well, they had such a great life, but it's like, well, they don't know like how a person could get to that point, because they don't know what it's like to like every day have to deal with this day in and day out chronic issues of just being able to get through the day sometimes. Or you could be doing great for 6 months, a year, and then all of a sudden get knocked down, which I think happened with Jess, my friend. And things build up, and before you know it, you're sitting in a hospital. And like that's not a bad thing. I'm gonna do a video about hospitals. Like they are good, like and I'm gonna like talk about some of the myths about hospitals and like different stuff. But it's whatever, you could be doing so well for a certain amount of time and then just get knocked down by it. And people don't understand that. So I don't think they understand like the connection between that and mental illness, and to say that like mental illness can kill. And that's what I was going back to, of like when somebody gets diagnosed with like those physical illnesses I was talking about, like they sort of know that like it could kill them, and so like they're really careful and like take their meds and everything else like that, and they know even if they do that stuff, it could kill them. And but they're with I think that people with mental illness that are diagnosed, and it's like a chronic thing, or even like a moderate thing, need to realize that it could get really bad if they don't look out for it. If it goes away, that they need to realize that it could come back, and that if it's something that they have to deal with day to day, they need to realize that they're going to have to deal with this day to day like any other illness. And I know it's really hard because people don't want to be sick, and they don't want to be like, oh, have to take medicine, or like it has side effects, or they don't want to go to therapy, they don't think it's working. But I think it's understanding that like you're not like willpower or whatever is not going to like work like maybe ever, or like, you know, the things that you're told to do like won't always work. And like somebody like a therapist telling you something is not like they haven't experienced it, so like they can tell you to like challenge your thoughts and whatever, but they haven't been sitting there thinking them for like 10 years, 20 years, all their life, you know, so they have no idea what's going on. I mean, when I was at the last place, when I was at Turning Point, I had that feeling that these people had no idea what it was like to have a mental illness. At least people here, like, they see people, the PRCs work like 12 hours a day, and they see people day in and day out with a mental illness and like with complications of it and different ways that it like manifests. And so they have like a respect for that this is not just, you know, someone, you know, acting up for the fun of it, or like they, you know, that the little pat things that you say to people, like I think most of the PRCs realize like are not going to work. Maybe they will work for like some people and maybe they won't, and for some people like at different times they might work, and for some people it might not, you know. But I think they have like a real respect for it, and I don't understand how someone could like get in the field of this and work with like people that have this serious illnesses and like then act like so arrogant, like they know what, you know, what they're talking about, and like, oh, this is really gonna work, and this is what you should do, and this is what you should think, and this is what you shouldn't think, and you shouldn't feel this way, and you should never be suicidal. Now I was sitting in the freaking hospital, and you know, the first hospitalization I was at, you know, they were a really good unit, but some of these people's attitude towards like being suicidal was like almost like it would be funny if it wasn't so horrible. Like this one guy, one of the techs was like, I told him, he's like, so what happened, blah blah blah. I'm like, oh well, I had a seizure and it was from one of my medications, and you know, he was like, oh well, medications is trial and error, and that shouldn't be a good enough reason for you to want to kill yourself. I'm sitting there thinking, well, obviously to you guys there isn't a good enough reason because I'm sitting here and not left alone, you know. It's like, oh my god, you know. And people are just crazy, you know. Oh no, you're really not suicidal, and you're really not whatever. It's like, well, yeah, I am, you know. And so I think that like there needs to be like a shift in society, and like even families and people that are going through this is to be like, okay, you know, this is a serious thing that can like kill me, and like how it can kill me is that like it just runs you down, you know, and you just honestly feel like there are no options. So, you know, it's really, really, really sad. And it's really, like, horrific what happens. And I'm just sitting here, like, thinking about my friend in the hospital. And I'm like, you know, like, she could die. I mean, not right now, obviously. Like, she's in the hospital and she's fine. And, like, I know she's going to come home and, like, be fine. But, like, over her lifetime, this is what she has to deal with. And, like, for her, like, different things are a lot more serious than for me. Like, just different stuff, different ways that, like, thoughts are, like, suicidal thoughts, whatever, you know. And just, I know her to the point that, like, I know that, like, if she's in that state and, like, she's just left to do her own thing, like, it could be really serious. And I just am heartbroken to the fact that, like, this could really kill her. And, like, you know, people don't understand why we live here, and they think like, oh, like just because like you're articulate and like, you know, can talk about your illness and stuff like that means that like you're really high functioning, and just because you can like at, you know, for good stretches of time, you know, do things like go to school or like, you know, volunteer, or like, you know, you're a smart person, you're an intelligent person, it doesn't mean that like this isn't like a huge issue. It doesn't mean that like one day you're gonna just, you know, that you know, say you're like really intelligent, like everyone's like, oh, you're so intelligent, like you're so articulate, like you don't need to be here, you know, which is people's attitude. And it's like, no, like, yeah, I'm intelligent, but it doesn't mean like in a moment of like being totally anxious that I'm not gonna like go hide in a corner and like shake and, you know, just hide. Or like in a moment of like being agitated, that I'm not gonna like shove people and like pinch people and scratch people, because that's how I'm like letting things out because I'm so overwhelmed. Or like, you know, that, yeah, I know that, you know, I shouldn't, you know, that I shouldn't go outside my care plan for self-injury, but then, you know, I know that, but then one day I could just, you know, do it because I'm just so overwhelmed, you know, and it's, so that's why we need to live here. That's why we need places like this to exist, because there are ways that, like, we can't be safe on certain things, and that, like, we need other people to, like, help us and, like, support us. And, you know, like, for example, like, I don't trust myself with, like, different, like, sharp objects, because I know I would, like, use them and it would be outside my care plan. So, like, everyone here knows that, and they know to keep them, like, away from me, you know. And some people, like, need to, obviously, you know, need to be on medication to, like, have some kind of a life, and, like, that's why they're here, you know. So it's like people think that, like, we're being locked up here, but, like, we're not. Like, I'd say, like, I don't know, like, every person in this place, but, you know, I think a lot of people here, like, are here because, like, they are, like, their families want them to, like, you know, have some kind of a life, and they don't want to lose their loved ones. And, like, you can't control whether someone, like, kills themselves or not, which is, like, what I was thinking about. But it's just, like, it's just really upsetting to think, like, you know, that people don't understand. Like, they don't understand, like, how severe mental illness is. They don't understand, like, why, like, you would want to kill yourself. They don't understand, like, why you would want to, like, do drugs or, like, alcohol or, like, have an eating disorder. Like, they don't understand, like, how that behavior, like, is actually, like, helpful, because if you don't do that, then, like, it could be, like, just too much, you know. And they just don't understand what's going on. So I was just thinking about, like, how people don't get it, that, like, mental illness can really, like, kill you, because, like, when it gets overwhelmed and, like, out of control, like, you know, you just can't stop it. It's just, like, runaway train, you know. Tommy Jameson, who does a lot of her videos on mental illness, she did a video called The Curse of Mental Illness, and she said, you know, it's like someone, like, hijacked your car, and you're just, like, have no control. And you could either, like, try to, you know, some people try to fight it, some people try to jump out, some people are just, like, resigned, you know, but it's like you are not in control at that moment. And, you know, anyway, so, yeah, I think I've made my point, and I've, like, talked forever, but I just hope some people watch this video and get a perspective on, like, what goes on, at least from, like, my point of view, and, like, every individual is different, so that maybe, like, you'll actually go home and, like, ask your kid, like, okay, how are you, like, really, and, like, you know, are you happy with your therapist, and, like, how are you doing with your meds, because if you're not happy with this person or, like, this meds, we can help you find something else. Or, like, you know, that you could, like, see a person on the street who's, like, you know, not, you know, well kept, or, you know, dirty, and, like, talking to themselves, and not, like, throw something at them, and instead be, like, compassionate, you know. Or, you know, you could, like, hear someone, like, gossiping about a friend and be like, oh, that person is just, like, a drama queen, whatever, you know, and actually, like, say, like, no, they have a serious illness. You know, I feel like people need to, like, stand up for other people. Like, you know, you have, like, gay rights, and, like, you know, racism, and, like, whatever, and disabilities, which mental illness is a disability, and, like, we already suck at, like, standing up for people with disabilities, because I know that, because I'm blind. I've been blind all my life, and I know other people with disabilities. So, like, you need to say, like, no, like, this person can't do this or that, or, like, this person has these issues and they're working on it, but, like, they're not going to be like the rest of everybody else, because, like, they have a compromise, you know. Like, I'm not going to, like, go drive a car, and, you know, people need to deal with that, you know, or just whatever, you know, limitations. You need to stand up for people, you know, and treat people with respect. So, yeah, I should stop talking, because I'm probably going to be like, people aren't going to watch this video because it's so long. But I'll talk to you guys later, and I'll do another vlog of how the rest of my day went later. Okay? Bye. Hope that wasn't too triggering for anybody. I'll have Miss Baby say goodbye. Miss Baby, wave to the camera. Okay, I think here. There. I hope you guys saw her. Come on.
My web stopped.